Risk factors for chronic kidney disease include an age above 60 years old, hypertension, diabetes, cardiovascular disease, and a family history of kidney disease. It is estimated that by the year of 2030, more than 2 million individuals in the U.S. will require renal dialysis or transplantation due to kidney failure. Given the prevalence of chronic kidney disease, it is important to understand the indications and consequences of the disease and subsequent renal replacement therapies, as well as their impact on physical therapy. The renal system is composed of the bladder, the urethra, ureters, and perhaps most importantly, the kidneys. Glomerular filtration is the process through which the kidneys can filter waste products and excess fluid from the blood. Each glomerulus contains a dense network of fenestrated capillaries which allows fluid from the bloodstream to leak into microtubules. The tubules selectively secrete and reabsorb components of the blood to create urine. This filtration process allows the body to eliminate undesirable components and excess fluids. Because the glomerular filtration rate indicates the kidney's ability to filter blood, it is a common metric used to measure kidney function and is often used to define an individual's stage of renal disease. When glomerular filtration rate is below 15%, renal dialysis will likely be needed. The kidneys function to filter out metabolic waste products, excess fluids, and chemicals from the body. It also assists in regulating blood volume and blood pressure, regulating electrolyte levels, and contributing to the maintenance of the body's acid-base balance. When the kidneys no longer function properly, dialysis is needed to complete these renal functions. The array of chronic kidney disease treatments allows the patient to choose an option that best suits their own lifestyle. Each treatment differs in location, time of treatment, length of treatment, and training that is required for both the patient and the caretaker. To begin option 1, hemodialysis, the patient must first choose which upper limb access point they will use for dialysis. The patient will decide from 3 options: a fistula, AV graft, or central venous catheter. Renal dialysis refers to the artificial process of removing waste and excess fluid from the body and is used when the body is unable to achieve this on its own. The process of renal dialysis is the diffusion of solute particles from the bloodstream across a semi-permeable membrane. Metabolic waste products, such as urea and creatinine, diffuse down the concentration gradient from systemic circulation into the dialysate. Typically, hemodialysis treatment occurs continuously for 3 to 4 hours 3 times per week. Travel time to and from the hospital, in addition to the actual treatment time, may be a large burden for some patients. Second option, peritoneal dialysis, is a popular treatment as it can be done in the patient's own home and is usually completed at night. Although this treatment type is accustomed to a more flexible lifestyle, extensive training is required for the patient as well as the caregiver. 4 weeks after the peritoneal catheter is placed, training for outpatient peritoneal dialysis begins. One type is completed manually every day of the week, where 4 to 5 exchanges may occur every day, each around 30 minutes. The second type is performed with a machine which operates throughout the night while the patient is asleep. It usually lasts for 8 to 10 hours. When it comes to deciding which route to take, the patient must weigh the pros and cons of all possibilities and choose a treatment that fits their lifestyle best. Common side effects of kidney disease include sleep apnea, restless leg syndrome, itchy skin, and nausea. These may be related to lifestyle and nutritional changes, depression, anxiety, or other psychosocial factors. Being a dialysis patient means strict treatment schedules, new medications, changes in diet, burden of caretakers, altered moods, and difficulties with travel. However, the care team is prepared to help in all of these domains to ensure the patient feels comfortable. Patients with chronic kidney disease typically have muscle atrophy, weakness, and poor physical performance. These deficits lead to both a loss of independence and vulnerability to disease complications. Exercise has been shown to improve patients' health outcomes, including cardiovascular health, systemic inflammation, physical performance, quality of life, and even the effectiveness of dialysis treatment itself. Choosing a modality for a specific patient's exercise program can be challenging and largely impacted by patient goals, preferences, and quality of life perceptions. There are several structural and psychological barriers which limit patient involvement, and such barriers may seem daunting. Taking the time to execute a well-thought-out exercise plan that takes into account patient goals, access to equipment, and scheduling is vital to their success both mentally and physically.